Hi, my name is Morgan Barentine, and I was fortunate to do research in the summer of 2020 under the Eureka Grant with Sam Houston State University. As a pre-medical student majoring in biomedical sciences with a health minor, I do plan to remain in a rural community as I pursue my career as a healthcare professional. And I find it extremely important to focus on the overall health of the population, as well as any type of chronic disease that happens to be common. And as we know, food associates directly towards our health. So it's very important to understand the diet of the community and what we need. So that being said, I decided to research the Sam Houston State University distribution content of our on-campus food pantry. So that way I could analyze the resources in a mini rural community. So technically Huntsville, Texas. And then, but more specifically, I was able to focus on the Sam Houston State University student and faculty population. So that way I could have a direct understanding and a better understanding of the community and the needs that we have here. The primary questions that I had for this research project was one, are rural food pantries receiving the resources that they need for the population to maintain a healthy lifestyle? And two, are rural food pantries receiving the resources that they need for a population to maintain a preventative lifestyle? So to prevent chronic diseases and stuff like that, that could happen as a direct result of an unhealthy diet or bad habits. So the methods and materials that were used was limited to Excel programming, data input, and basic formulation. And I did that by analyzing the Sam Houston State University Food Pantry receipts at purchase from the local HEB that we used to purchase products that we either didn't have or we ran out of. And then also by using that information, we can kind of estimate depending on what we purchased and how we purchased it and where we got it from. We can also see what we had available and what we didn't have available. So that was also important to know because that could tell us, okay, were we receiving enough fresh fruits and vegetables, or did we have to go buy them ourselves and that kind of thing. So also what we did as well is I was able to use the internal data logging regarding the visits. So whenever students and faculty show up to use the food pantry, they swipe their Sam Houston State University ID cards or their Bearcat One card. So we could also track how often they were visiting and how many people were visiting every single visit throughout the month. So the data from the receipts of purchase from HEB are a representation of only the purchased products and produce. So it wasn't based on anything that we received from local donations or community donations or even student staff donations. It was all stuff that we had purchased for the pantry itself. So under the supervision of Dr. Amanda Scarborough in population health, I received the receipts from the months of January 2020 through July 2020. And I was able to break down the content into a couple of categories as seen in this first graph here. So the primary categories are perishable versus non-perishable foods. So the perishable foods are blue and the non-perishable foods are orange. And then in between that, I also broke everything down into subcategories. So we have the dairy and non-dairy products, the fruits and vegetables, starches and grains, protein, and miscellaneous. So after breaking everything down, it looked into the products that we had throughout all 7 months. So January, February, March, April, May, June, and July. After that, we were able to, in this second graph down here, we were able to break it down the cost per month that we were spending. And in this analysis, we also took in consideration the impact that the pandemic had. So the months January, February, and March were considered pre-pandemic, and April, May, June, and July are post-pandemic. So we were able to see the impact that it had throughout that time that the entire world changed. So not shown in a graphic here, but we also looked into, it's important to note that based on the number of Bearcat One cards that were scanned and used during the months of January through July, the visits only slightly decreased after the pandemic. So whenever the pandemic started to get really bad and we were sent home in the month of March, or we just didn't come home from spring break, during the months of March, April, May, June, and July, we still had visits. So there was still a need on campus and in the community for a food pantry. And that was potentially maybe one of their only resources for food during the entire crisis. So after analyzing that, we were able to conclude that technically the Sam Houston Food Pantry is receiving the proper resources we need to maintain a healthy and preventative lifestyle based on our perishable fruits and vegetables and all the fresh foods, and also the types of protein and everything that we received. So, but the only way that we had that happen was through funding. If we did not have funding, it was much less likely that we would have had those things available to us. So taking that into consideration, we were mostly relying on donations at the time. So donations play a really big part in what we get and how our constituents use the food pantry and how they utilize it and what they get out of it. So taking that into consideration and looking at the pandemic, the resources also during the months of April through July, the resources that we needed were extremely scarce and very limited because there were restrictions on the amount of product that we could buy and what we could buy. So due to local restrictions, it ended up resulting in a really drastic increase of non-perishable and processed foods as opposed to fresh fruits and vegetables. But the visits, like I said, still remained steady. So there was still a need for those fresh fruits and vegetables and all the healthy items, but they just weren't there and we couldn't have access to it. So an idea that we had was to prepare for the inevitable future of another crisis, whether it's another winter storm or another pandemic or something happens where there's a crisis and it directly impacts us and directly impacts the health of the community. We can possibly potentially become self-sustainable to an extent. So by advertising the need for fresh produce to the community, as well as donations to the community a little bit more, and through advertising and word of mouth and going to local vendors or farmers markets, it's possible that we can increase the likelihood of receiving donations of fresh and perishable foods and produce, which would result in a higher availability of those foods and produce to students and faculty of the more vulnerable population of the rural community that we have here. So as a result of that, in turn, by increasing the availability of healthy foods, we can potentially decrease in the long run the rate of chronic diseases caused by unhealthy diets and habits among the more vulnerable population. So if a produce garden or a greenhouse were started and maintained, possibly by Sam Houston State University food pantry staff, volunteers, or even agriculture students, it would be monitored, cared for, harvested, all by volunteers or students or educated workers. In the event of emergency, that would basically guarantee us access to fresh foods and vegetables, and we would still have access to healthy choices even during a crisis. And that is the entire summary of the research that I did. I just want to thank the Sam Houston Food Pantry and the Eureka Grant Program, as well as anyone else who may have contributed to this that didn't have a direct impact on me and my life. I just want to thank you. And then this is the first time that I've presented at an undergraduate symposium. So I'm really excited that I was able to do this, even in the event of the pandemic, and the fact that it's virtual is a little bit weird. So I thank you for taking your time to watch this and critique me, and I'm really excited to hear from you. Thank you.